To date, there are about 52,000 active cases in Canada, and despite having over 315,000 cumulative cases, less than 1% of the population across the country has tested positive for COVID-19 to date. This is an important reminder that the vast majority of Canadians remain susceptible to infection. With continued rapid growth in daily case counts, rising numbers of hospitalizations and deaths, and spread in high-risk populations and settings, there is urgency to quickly bring infection rates down across the country. Looking to the experience of other countries, many of which have been ahead of Canada's trajectory, helps us to anticipate what we might expect to see here in the coming weeks. Several Western European nations that experience resurgence are seeing hospitalization rates approach or surpass the height of the first wave, which is causing immense strain on their health systems. In response to surging hospitalizations, these countries close non-essential businesses and ask citizens to limit outings to essentials while keeping schools open. As a result, some countries, including France and Belgium, are beginning to see a decline in disease activity. The longer-range forecast shows how the epidemic could evolve in Canada over the next 2 months. What we're aiming for is the safer blue line trajectory. This will require combined effort of individual Canadians and public health authorities in order to sufficiently reduce the current number of people we come into contact with each day. For individual Canadians, this means, whenever possible, reducing the number of people we come into contact with each day while maintaining hand hygiene, physical distancing, and face mask precautions. For public health authorities, this means implementing time-limited restrictions and control measures to further reduce the number of people coming into contact each day across the population. Without sufficient reduction in contact rates, we are forecasting to have 20,000 cases daily by the end of December, with an attendant increase in hospitalizations and deaths. The only way for Canada to stop the rapid growth of COVID-19 and keep our health, social, and economic systems functioning is for individuals and public health authorities to work together. This won't be forever. Recently, there has been some very good news about vaccine development. Keep this beacon of hope in mind as we all come together apart to do what is needed. Right now, every effort you make as an individual matters. Our best protection for ourselves, our families, and communities is to limit errands and outings to the essentials, keep in-person social activities to your existing household, and strictly and consistently follow public health measures. This includes planning ahead for safer holidays to ensure that we consider the risks, limit our in-person contacts, and get creative so that we can still have meaningful celebrations that are so important for maintaining our traditions and social connections. Thank you.